In today's video, I'm going to go over the top 5 reasons why you would not want to get a Medicare supplement plan. If you don't know who I am, my name is Brian Monahan. I've been working with people that are either on Medicare or going on Medicare for the first time for the past 15 years. In my videos, I try to give you numbers and raw data so that you can make a decision on which plan is best for you. I'm licensed in 46 states and I work with people throughout the entire country, signing them up for Medigap plans as well as Medicare Advantage plans and reassuring them that they're getting the correct plan. So let's jump into the video. The first thing that you see is you have your Medicare A and B card. The reason why I have this on the screen is because everyone is going to have to get a Medicare A and B card in order to either get a supplement plan or get a Medicare Advantage plan. On average, this card is going to cost you $164.90 a month. And the majority of the people are going to pay that price for this card. There's some people that are high income earners that are going to pay more, and some that are low income earners that are going to pay less. But that is the average for the majority of the people I talk to. So the first thing you do is you're going to have to sign up for Medicare A and B. But here comes the first reason why you would not get a Medicare supplement plan. This could be because you're on your work plan and they have either cheaper, it could be better, cheaper and better benefits than Medicare has to offer. Or you could have a spouse on the plan with you and you actually do not want to get on Medicare, so you would deny your Part B, and obviously you would not want to get a supplement. Now, some companies want you to get on Medicare and then their company plan would be the supplemental plan. There's all sorts of things that could go on if you're still working past 65 years old, but that would be the number one reason why you would not want to get on a supplement plan. Okay, number 2, I want to dive into the numbers here and show you. If you see on the left-hand side, I have Medicare plans, and then underneath there I have Medigap Plan G and Plan N. These are two of the most popular Medicare supplement plans throughout the country. Underneath that I have an Advantage plan, and I'm going to go over the two numbers of these plans so that you can actually see, would I get a Medicare supplement plan or would I get a Medicare Advantage plan, or do I want neither one of these plans? Okay, so the very first thing that people tend to, when they don't want a Medicare supplement plan, it's because they can't afford it. Now, if you see at the premiums, on average, someone who's turning 65, a Medigap plan or Medicare Supplement Plan G is going to cost around $140 per month. Some people cannot afford this. The one thing about, well, I'll go into the N plan also. The N plan is going to cost on average around $100 a month. Now, if you live in an area where things are a little bit cheaper, maybe houses are cheaper and so forth, these numbers are going to be lower. If you live in New York City or San Francisco or somewhere where it's really expensive, obviously these numbers are going to be higher. But let's take a look what you get for this. Now, the Advantage plans, as you see, most of them are HMOs and PPOs, and there's zero premium. They do not cost anything up front. So this would be a reason why somebody would want to get an Advantage plan as opposed to the Medicare supplement plans. This at least is what they think. When you see the premiums, what do you get for this and how can anything be zero? Well, the reason why they're zero is they get subsidies from the government. The government gives them money each month to service these plans. They make up the plans, the private companies. They service the plans. They basically do everything. The government says, here, you take care of it. You take care of these plans and the people on the plans. That's how it's zero. And they give them maybe $1,000 a month, maybe more, to service them. The Gap plans do not get those subsidies. So they're actually charging you for the service that they're doing. And that's why they're more expensive. But let's move down a little bit to hospital and doctor coverage. Now, with the Medigap Plan G and the Plan N, you're going to pay nothing for inpatient care. That's hospital, anything that's inpatient. Whether you stay overnight and so forth, you're going to pay zero. With the Medicare Advantage plans, I have seen where they're $195 a day in the hospital, or they could be up to $300 a day, maybe even more for a hospital stay. So even though if I scroll back here, you're getting this zero premium, if you have to go into the hospital multiple times during the year, you're going to end up paying this cost. And it could be $195 on the cheap end, or it could be on the high end, something like $300 a day. Whereas the Plan G and the Plan N are zero. So let's move down to doctors. So with the Medigap Plan G, this plan only has one deductible. It has no copays for inpatient and outpatient. The deductible is actually for outpatient. It's $226 for the year. Once you pay that, that could be 2, 3, 4 doctor's visits. You pay that off. You will pay nothing for inpatient or outpatient services. What does this cover? Covers hospital stays, hospital surgeries, urgent care, doctor's visits, specialist visits, ambulance. I could go on and on and on. But I have hundreds upon hundreds of people on the G plan, and they never complain about the benefits because they don't pay anything but that $226. Now, the Plan N, as you see here under doctors and specialists, it's the same thing as the Plan G. They charge that $226 for the year, but they charge up to $20 each time you go to the doctor. Now, when I say up to $20, they can charge you $0, $5, $10, $13, or $20, whatever it may be, all 0 to 20. A lot of doctors don't charge at all. Some doctors charge 10. The average supposedly is somewhere in between $10 and $15. But that's only for the N plan. The G, you don't pay that. The N, you do. But that's why the N costs about $40 less a month. Now, with the Medicare Advantage plans, a lot of these plans you pay $0 going to your primary care physician. How is this? Because your primary care physician is getting paid, obviously. Well, the reason is there's an 8-minute rule with Medicare, so they do charge for these, and they get paid for them. But as the Advantage plan charges $0 for this cost because they're getting subsidies coming in from the government, and they feel like they don't have to charge this because they can still make money with the primary care physicians. They can make money elsewhere, especially with the subsidies. I say this because you have to remember nothing in this country is for free, so beware of these subsidies. This is not going to go on forever. Okay, so over to the specialists. I talked about the same thing. Plan G, once you pay that $226, you don't pay anything else. But with the Plan N, up to $20 for specialists. Now, with the Advantage plans, they could be $35 each time you go to the specialist, $50. This is where they start charging you copays. It goes from the specialists, and it keeps going up from there. Whereas the Medigap Plan G and N, it doesn't move. So let's scroll down a little bit. What else, I hear from people, what is important to them? CAT scans, PET scans, MRIs, that sort of thing. Urgent care, whatever it may be. Medigap Plan G, you pay nothing. Once again, it's the first $226, $0 after that. Plan N, up to $20. Medicare Advantage plans. I've seen this where it's $195, $250, $300 for a CAT scan. Now, if you have to get 3 of those in one, couple months or whatever it may be, you're already up to $600, $900, whatever it may be. I've seen people, this is what they complain about. Now, here is the biggest thing, and I'm going to get into the 5 reasons of why you wouldn't want a Medicare Supplement plan, but I have to go over all of these plans because this is what you're going to look at when you look at what plan that you want. So as I scroll down, I talked about the work plan, and I'm looking at my notes here. Another reason would be that there's a fantastic Medicare Advantage plan in your area. I've talked about this in some of my other videos. And before I move on, if you look in the description box, you'll see that I have a free book that's a PDF. It goes right to my website. You can read it right there. That will be a link down there. And I also have other links that will help you out with different information. But I talk about, because I'm from Philadelphia, there's a plan that's a Medicare Advantage plan. I think it's fantastic. I have 65 clients on it right now. I probably will have over 100 by the next year. And the reason being is because all the cost is low, the maximum out of pocket is high, but that's if you really have to do something like go in for cancer treatments all the time and so forth. Most of my clients go nowhere near the maximum out of pocket, but it's also taken by 84,000 doctors in the area and pretty much every hospital in Philadelphia. And that's why I put my clients on that. But as far as other Advantage plans that I've seen, if they have a low premium and a low maximum out of pocket, something is most likely wrong with the plan, meaning it is not going to be accepted at many places. So you have to watch out for that. But let's talk about skilled nursing, because there is a major reason why skilled nursing is so crucial when it comes to Medicare. And I never used to talk about this 10 years ago, even 15 years ago when I first started. I used to tell people, really, I didn't sell any Medicare Advantage plans. I just sold Medicare Supplement Plans. Reason being is because 15 years ago or whatever, about 13 years ago, let's say 2010, the Medicare Advantage plans were horrible. Everybody was leaving. All I did was go to people's homes back then, and they were leaving Advantage plans, going to Medigap plans, and I would just switch them over. Reason being is Advantage plans went from zero premium all the way up to $125 a month, plus copays, plus a high maximum out of pocket. And when you looked at the Medigap plans, there was no comparison. Everybody wanted to go to Medigap in those days. But what I used to talk to people about is heart attacks and cancer and so forth. And I really used to talk about that when it came to Medicare plans. But what I left out until I started meeting people who were 65 years old who had already had strokes. And strokes, if you know anyone who's had a stroke, this not only is a major, major thing that can be debilitating for life, but it also costs a lot of money. There's a lot of hospitalization. There's a lot of skilled nursing. There's a lot of training afterwards to get back to where you were prior to the stroke. And this is where the skilled nursing comes in. So with Medigap Plan G and N, you get 100 days of skilled nursing care. Now, I'll go back to the stroke. If you had a stroke and you went in a hospital, they would get you to where you were stable. They would send you to skilled nursing, most likely. This is most likely. You could be in there for 90 days in skilled nursing. This would cost you $0. Whereas the Advantage plans, a lot of them give 20 days at $0 cost, and then they might be $195 per day after that. This is a major, major thing that a lot of people don't see until it happens to them. Here's another thing. There's a lot of skilled nursing facilities that will not accept a lot of these Advantage plans. Some of them accept 0 Advantage plans. I've had people call me and they said, look, I've tried to get my husband or wife I remember a specific person calling me, wanted to get her husband, had a stroke, wanted to get him in a specific skilled nursing facility. She called around to 10 different facilities. They would not take her Advantage plan or any Advantage plans. And she wanted to get her husband on a gap plan. She said, is there anything we can do? And I told her, no. I hate to tell you this, but if you would have got him on even a high deductible G plan, which would have cost $40 a month or something very, very cheap when he first went on Medicare, I could get him into whatever facility you needed. But because he's not on any gap plan, they don't accept Medicare Advantage plans. This was a real gut punch to her, and I felt bad telling her, but that's what the truth was. So skilled nursing is very, very important, and when people are 65, normally they don't think about it. It's more along the lines of when they hit like 75 years old, maybe 78 years old, they really start thinking about that, because that can be a major cost out of pocket. But that's not one of the reasons why you do not want a Medigap plan, as I just went over. Okay, so another reason would be, and this goes back to the premiums. So I'll scroll back here. If you live in a place like New York City, I get calls from people all the time there, and the Medigap plan, they might be 65 years old, and the Medigap plan is $365 a month, whereas they can get an Advantage plan for $0. This is something that they really have to dig into and look at the Advantage plans. But this is one of the reasons, one of the 5, I'll say it's number 3, of why they would not want to get a Medigap plan, is because it's just too expensive and they can't afford it. But like everything else in New York City, the reason why it's expensive like that is because the gap plans, you can go from one Medigap Plan G to another every year without underwriting. Well, if you think in a capitalistic society, people have to make money. And so what does the company do when people can come in and out as they please? They start raising the premiums. And that's why it's so expensive in that city. And I have helped people get on Medicare Advantage plans in that city as well as other cities because they just simply cannot afford it. They might live in an area that is not a high income area, but the prices are still very, very high because if they get on a Medigap plan, they could still go to those same hospitals, those high-end hospitals in New York City. So I guess the companies have to charge more money. Okay, so let's get back to the maximum out of pocket. This is the MOOP per year. Now with the Medigap Plan G, I always say this is very clean. And sometimes I've watched some videos where some agents don't like the Plan G because they say that it goes up in price more than others. One of the benefits that you get with this plan is it's clean, meaning you know this is my premium. The only other thing I have to pay for is $226. And so someone who's 65, who's paying $140 a month, they know that they're going to pay less than $2,000 for the year for the best coverage in the country. They can go to any doctor or hospital that accepts Medicare. Doesn't matter what company they have the Plan G with. They can go anywhere. Same thing with Plan N and high deductible G, high deductible F, any Medigap plan. The only question you have to ask is, do you accept Medicare? If they do, you can go there. And over 95% of the places and doctors do accept Medicare. So with the Medicare Advantage plans, and I'm sorry, so the Plan N is going to be cheaper most likely than $2,000. Of course, if you went to the doctor every week for 52 weeks, you're going to have to add that up to $20. And if they charged you that $20, then you're going to pay over $2,000 for the year. But if you only go to the doctor 5 times during the year, let's say, you're not going to even spend $2,000 because just like the G, you pay that $226 up to $20. The premium is $40 less per month. So if you do the math, it's going to be even cheaper than that. There's a lot of agents out there now that are pushing the N plan more than the G plan, and I do understand why they're doing that. I always tell in all my videos, and I have it here. I think I have it up here. Not that one. All my videos, I show this chart. There's 3 Medigap plans that I actually tell people about, and most of them already know from seeing my videos, but it's G, N, and high deductible G. If they were eligible for Medicare prior to 2020, it could be F and high deductible F. But if they're just coming on to Medicare in 2023 or 2024, it's going to be G, N, and high deductible G. So it's very simple. It's only 3 plans, and I have 2 of them listed here. But the maximum amount of pocket per year for the Medicare Advantage plans, I've seen as low as, let's say, $1,500 for the year. I've seen as high as $10,000 and over. Now, here's the problem. I said this earlier in this video. If you're paying 0 premium and the maximum out of pocket is $3,500 for the year, I'm telling you right now, you're losing something. There's no way that this could be some amazing plan that you're paying this 0 premium, 0 to go to the doctors, and the maximum out of pocket that you're going to spend is $3,500. And here is what it is. You are not going to be able to go to every doctor, hospital, specialist, skilled nursing facility that you want to. It is literally impossible to put those 3 things together. Picture a triangle. You can only have 2 of them, and with one of those plans, it's not, freedom is gone. So you might get the cost of the premium, you might get the cost of the maximum out of pocket, but the freedom to go wherever you want is gone. Now, if what brings me to why you might not want to get a Medicare Supplement Plan, so we'll call this number 4, I guess, is I have clients that literally stay in the city that they live. They don't travel, that all their cousins and whoever is in that one city. So they might get on even an HMO plan or a PPO plan where they have these low premiums and this low maximum out of pocket, and they can only go to certain doctors and hospitals, and they're okay with that because literally they never travel. They might be 65 or 70 years old, and they know they're staying in that city for the rest of their lives. That's how they live their lives. So that would be a reason why they wouldn't want to get a Medigap plan, because if they're on, like I said, in Philadelphia, I have clients where they have their world is right there, and they know they can go here, there, and the other place, and so they do not want a Medigap plan. All right, so here's another reason that you might not want a Medigap plan. This is sometimes one of the biggest reasons. With an Advantage plan, you get, most times, a drug plan for free, a dental, vision, and hearing plan for free, a gym membership for free, and a flex card for free. You get none of these things with the Medicare Supplement Plans. Now in 2023 and probably beyond, there are some companies that will give you a dental, vision, and hearing plan and a gym membership plan with their Medigap plans. So you have to call my office and ask, but there are companies that do that with the Medigap plans. But most of them do not. So you're getting your hospital and doctor or inpatient and outpatient coverage, but you're not getting a drug plan, a dental, vision, and hearing, or a gym membership, or a flex card. With the Advantage plans, you are. So that would be one reason why people do not want to get on a Medicare Supplement Plan, because they want to combine all these things onto one plan. Sometimes it's the smart move, sometimes it's not. You really have to talk to a broker like myself. I've had my phone number on the screen. This is what we do. I shouldn't say, because I'm not a one-man show, so I have people that work with me. This is what we do all day, every day, is speak to people about their Medigap plans or Medicare Advantage plans, people that are turning 65 or going on to Medicare for the first time. We specialize in that. We help them through A to Z with Medicare and explain it and show them the plans that they might want to get. So I actually have down here, I put free weekly lotto tickets for life. Now, of course, the Medigap plans do not have this. I would not be shocked if the Advantage plans did something like this. And this sounds kooky and it's weird, and this is why I put it at the end, is because in a lot of states, who benefits from the lotto? It is actually the senior community. Now, they actually buy a lot of lottery tickets, but they also benefit. When you buy a lottery ticket and you're 30 years old or whatever, a lot of these states, it benefits either schools, school children and so forth, or senior citizens. I would not be shocked if they started doing something like that. It's kind of tongue-in-cheek that I put it in there or whatever, but I wouldn't be shocked if they started adding more and more things to entice people to get on the Medicare Advantage plans. And the last thing, number 5, why you would not get on a Medicare Supplement Plan is because I get these calls all the time where they say, I called this person and he did not even mention one Medicare Supplement Plan. He was pushing the Medicare Advantage plans. Well, there's a lot of agents out there that push the Medicare Advantage plans, and they don't even talk about the Gap plans, and it's because of benefits that's going to them. Now, in my company, we don't push any plans. I show 3 Medigap plans and usually 1 or 2 Advantage plans if the person wants to see Advantage plans, and that's it. Try to get them to where someone can pick their own plan and say, this is the one that I want. It's not about us pushing a plan on somebody because of some commission or because we know the people at that company or whatever the case is. We want to get you on the best plan that's for you. Once again, thanks for watching this video. I hope that it helped. Please subscribe to the channel, and the biggest compliment that you can give me is either emailing this video to one of your friends or putting it on your Facebook page, especially putting the video on your Facebook page. It helps get this information out to a lot of people. Don't forget that the free book link is in the description box, and I'll see you at the next video.